We'll go ahead and get started. All right, thanks for joining everybody. This is the first episode of season 4 of Hillels On One Foot series. We've created this series to be a virtual learning forum, I suppose. We launched it during the pandemic, but it was popular and continues to be, so we've kept it going. It's a series that features a different Jewish faculty member from our local universities once a month in season 4 to spotlight the incredible Jewish intellectual talent that we have here in Memphis. And it's for the entire Jewish community to enjoy. I'm glad you've chosen to join us. Our guest speakers are encouraged to discuss their academic area, but frame it in a context that provides us some ideas about how to navigate life's challenges today, as well as identify with our own Jewish journey. Today we have Dr. Naomi Eichorn. She is a University of Memphis professor with expertise in cognition, language, and speech. She's the director of the Cognition, Language, and Speech Laboratory at the University of Memphis. And she and those that work with her focus on how cognitive processes such as attention and memory interact with speech and language functions. I'm really fascinated by this. I grew up as a stutterer and I still stutter today. As an adult, I've learned ways to manage it. So it's very auspicious, perhaps, that my first experience moderating an On One Foot involves this topic. So with that, I'm going to turn it over to Naomi. Let's have a casual sort of open forum. She's going to lead the lecture, but if anybody wants to put a question in the chat or even, I guess not raise your hand, but voice a question, that's allowed. So, and we'll also do a Q&A at the end too. So if you prefer to wait, that's fine. So let's get going.
All right, great. Well, thank you so much. Hello, everybody. It's good to see you. I appreciate your being here on a Friday afternoon. I know it's beautiful outside. Probably all have a lot to do. So thank you for being here. Thank you, Matt, for the introduction, and Sophie for inviting me to participate in this lecture series, and for coordinating this opportunity for Jewish faculty to connect with the larger community. So I'm excited to be here and to share some of my work related to stuttering. It's my primary research area and also a clinical interest, and I teach a course related to stuttering as well as some related courses. So I hope that I'll share the interest and I can pique your interest if you've never thought about this topic before. So I'm going to share my screen and organize some information that way. Okay, are you seeing my PowerPoint now? Okay, yep. Great. So let's just see. Okay, so I know Matt mentioned that you share my name. I'm Naomi Eichorn, and I just wanted to also share, I'm an assistant professor currently. I'm in the School of Communication Sciences and Disorders. Some of you may or may not be familiar with this program at the U of M. We're actually a graduate-only program, and we train students to become speech language pathologists as well as audiologists. This is our beautiful, relatively new building. We moved there just about when I moved here. So I was lucky enough to move in along with everybody else into such a nice working space. And I'll share a little bit more about that soon. So I wanted to share a little bit more about my background and maybe some key points along my journey to Memphis and to the program here. I'm originally from New York. I don't know if anybody here might be a CUNY graduate or familiar with Brooklyn College, but Boylan Hall is where I did my training as a speech pathologist. We took all of our courses there. We had the speech and hearing clinic there. And it was where I really picked up most of what I know in terms of my clinical training. And while I was a student there, I heard a talk about stuttering by somebody named Catherine Otto Montgomery. And she's the woman who's pictured here. She was the director of an organization called the American Institute for Stuttering, which is an organization located in Lower Manhattan that provides a very unique kind of intensive therapy treatment for people who stutter. And it's unique because it's intensive, it's a week-long program, but it's also very holistic. And when I talk more about the different kinds of features of stuttering, I think you'll understand more what I mean about holistic. It wasn't just designed to address like surface features that most of us are familiar with in terms of when, what you think about when you think about stuttering, but also some of the deeper layers that more people are not familiar with. And anyway, I heard her present and I was just hooked. So I ended up doing an internship with her as a grad student and did some other specialized training related to stuttering in New York and also actually in Israel with a woman named Barbara Dam there, who helped me actually shape some of my research interests related to stuttering, because she was the one that introduced me to the idea that maybe sometimes helping people not think about stuttering and speech production in general could be very beneficial. And I'll talk more about that soon. So after I graduated, I worked as a hospital-based speech pathologist. And I don't know, again, if anybody is familiar with some of the New York hospitals, but the hospital I worked at was called St. Vincent's. And then I eventually returned to CUNY at the Graduate Center where I did my PhD, and my research training really focused on aspects of cognition and executive function and how these might relate to speech and language disorders. So I did some work related to language disorders in kids, but really focused most of my research on stuttering and these kinds of interactions as they relate to that particular disorder. And then in 2016, I moved here to Memphis with my husband and then 2 kids. I since had twins during COVID, which was very exciting and fun. Again, we moved to this, our program moved to this beautiful building right when I moved here. And in case any of you are not familiar with it, this part of the campus is located on Park Avenue in Getwell, and it houses both the CSD or Communication Sciences and Disorders program, as well as the nursing program. And it has our speech and hearing clinic and all of the faculty labs. So here are some pictures from my research lab. We call it the CLASS lab, and this stands for Cognition, Language, and Speech Lab. And all that to say that we mostly study how aspects of cognition, particularly attention, influences or interacts with different speech and language processes, particularly as this relates to stuttering. And many of our recent studies have actually focused on children. Sometimes I think I do this, I don't know, somewhat unconsciously because I include my own kids in the studies. So it's very convenient when I get their friends into the lab. But the truth of the matter is, in all seriousness, there are some very important questions about stuttering that are best answered with kids. And a little bit more about that soon, because of the way many kids will stutter early on and then outgrow it. That kind of brings up some very interesting questions about factors that might be related to stuttering and stuttering persistence. But currently we're running studies for both adults and kids, and we use a variety of different experimental methodologies. Some of these include pretty classic types of tasks that use measures like reaction time and accuracy to assess performance. But we recently incorporated some new eye tracking equipment. And I'll talk about that also a little bit later if we have time, but it gives us some really interesting and important information about what participants are doing with their attention over the course of a task, because you can track where their attention is going on the screen throughout the task. In the picture that you see on the lower right, my son, as you can see, was being very instrumental in helping me set up this new equipment and tasks in the lab. So my plan for the talk today was to share some general information about what stuttering is, and also focus on what you as non-clinicians, as listeners, might be able to do to support people who stutter. I also wanted to summarize some of the key findings from my research on stuttering, and I'll keep that part pretty light. I wanted to also give you maybe a little demo of some of these tasks so you get an idea of what it looks like to be a participant, or what the experiments look like as they're being run, and then some key findings or takeaway points from these. And I'll share some current research opportunities, because I always want to recruit participants to the lab, both people who stutter as well as non-stuttering participants, because we're always looking for controls too. And then, as Matt said, I mean, I included time at the end for questions, but really I'm happy for this talk to be interactive. So if you want to post something in the chat, I've been getting better over the last 2 years of, paying attention to the chat too, so that if questions come up, I'm happy to answer them. You could also kind of raise a Zoom hand and we can do it that way. So I'm fine with that. I'm flexible, and a casual type of format is perfectly fine with me. So on that note, does anybody have any general questions before I talk a bit more about stuttering? Or we're all good? Okay. So I will just jump right in, and this is not related to stuttering, actually. I don't know if anybody is familiar with this particular journal, Frontiers for Young Minds. I've been coming across some recent papers on it that I'm really enjoying, because it sums up some important information in a very, it's for kids, so it's a very accessible format. I've been actually sharing it with my son, who's now 10. There was a paper recently in 2020 about stuttering, and I shared that with him so that he understood a little bit more about what I do. And I've come across a few papers there recently about a variety of topics that were really nicely written. So this little image is from a paper from that journal and it's written by Hope Gerlach and some others. But it describes what we call the core behaviors of stuttering. And so these are the symptoms that most people are familiar with, and they essentially consist of interruptions in the flow of speech. And these interruptions can take a variety of forms. So the most common ones are repetitions, and these might include repetitions of sounds like so, or a syllable, as you can see in the picture here, table. Or even whole words or phrases. Another common type of interruption or disfluency, as we commonly refer to it, is a prolongation, where a sound, usually it's the initial sound, but it could actually be middle sounds or sometimes even final sounds, which is something that I came across recently in the lab, and I see there's a question in the chat. I'll get to that in just a second. But the prolongations involve a stretching or holding of the sound. So it might sound like that. And the last most common type of core behavior is a block. And this is when sound basically just ceases, and the sound is stuck. So you might not hear anything at all, or you might hear some tense attempt to push the sound out, but it might sound something like that. So that would be a block. And there are some other features, but these are the most common ones. And a complicated aspect of stuttering that I also wanted to introduce here is that many speakers who stutter, especially once they've been doing it for a while, will start to anticipate their stuttering and start to come up with ways to avoid it. And this could involve all kinds of behaviors to prevent, again, those observable types of symptoms. And so it could be, for example, talking around a word instead of saying it directly. So we would call this circumlocution. It could involve substituting an alternative word, or even avoiding speaking situations in general. And so we refer to these overall as avoidance behaviors. And, they conceal stuttering, but at a very significant cost to the speaker's quality of life and to the communication experience. So it's a tricky part of stuttering because you don't see it, but it's a really important part to address. Be, again, more significant and more problematic than the surface features themselves. So let me take a look at the chat. Oh, we have a volunteer. I'm so happy. Thank you. Okay, so I will be in touch with you after the talk to follow up. Now, many of you are probably familiar with these various examples of stuttering that come up in the media and movies. And I'm not going to actually talk too much about most of these, because I think that many of these examples actually get it wrong, and they don't represent stuttering accurately. So without getting into details, I'm just going to say that a lot of these could be very misleading, and you need to be careful about what you're watching or what kinds of assumptions you're forming about stuttering based on popular media. But I did put an asterisk next to one of them. I don't know how many of you can identify this picture from the King's Speech, but this is an example of a movie that actually did get it right. So I think this movie gives a very accurate and very nuanced and insightful view of what it means to stutter, and also what effective intervention could look like. And for those who have watched it, it might have surprised you to see the type of intervention that was being offered, but it was very effective, and it's very much consistent with many of the approaches that we use today. Another piece I wanted to mention, I don't know how many of you saw this recent opinion video in the New York Times. This person's name is John Hendrickson. He's the person that he actually wrote a piece about President Biden before he was elected to office during the campaign. That was very, very interesting. And this opinion video is a very thought-provoking one. So I can't actually play it here because it was bringing up all kinds of ads, but I did include the link, and I hope some of you will check it out. It gives some really important, thoughtful perspectives on what stuttering is, and more particularly what listeners can do about it. So I'll talk a little bit more about that. But again, that was just in August. So I don't know, it was about 3 weeks ago or so. So I wanted to share some very basic facts about stuttering that I thought could give you all a helpful understanding about what stuttering is all about. So we know that stuttering generally begins in early childhood. The onset is usually somewhere between age 2 and 5, with the average age of onset being right around age 3. And what's super interesting about childhood stuttering is that in most cases, in fact, yeah, it's about 70% of cases, the numbers vary somewhat from study to study, but children spontaneously recover. And when I say spontaneously recover, I mean no therapy. So they just grow out of it. Now, the thing is, it's hard to know who will recover and who's going to persist. So again, in most cases, the children will spontaneously recover, and this seems to happen in about 70% of cases, but that smaller percentage, maybe it's a third, maybe it's a quarter of kids, they persist in their stuttering. Now, there are a good number of risk factors that we know are associated with persistence. As an example, we know that a family history of stuttering, or being male, or having certain kinds of stuttering symptoms are predictive of persistence, but it's really very hard to predict with absolute certainty what any individual child's outcome is going to be. And so therefore, a lot of young children who stutter, especially if there are a few risk factors that are identified, will in fact receive intervention so that they have as strong a likelihood as possible of showing improvement. And the kinds of changes that we see in young children are far more significant than what you can achieve after, say, age 6, when stuttering has already persisted. At that point, it's never going to totally disappear, but in childhood, sometimes it really does. And so that's why early intervention is so important. Now, in terms of prevalence, stuttering occurs in about 2.4% of preschoolers, and the number goes down for adults, as we said, because a lot of children are going to recover. But it's about 1% of adults that stutter, and the prevalence is far greater among males relative to females. So you can see it's about 8 to 1, particularly in adults. It's actually a much more even ratio for young children, which tells us that it's actually more often the females that outgrow it than the boys. So as we mentioned before, there are observable symptoms like the repetitions, the prolongations, the blocks, but then there are also all kinds of hidden features. And this is what many people don't realize about stuttering, such as these avoidance behaviors that we talked about before, and a whole host of psychosocial symptoms that come along that develop over time. And another important point about these hidden features is that they aren't necessarily correlated in severity with the observable symptoms, and can sometimes be far more debilitating than the actual disfluencies themselves. So, sometimes you'll have somebody with a lot of observable symptoms that doesn't really seem to react very much to those symptoms. And then sometimes the opposite, you might not even hear stuttering in a particular speaker, but they have very significant reactions to their stuttering and might, let's say, be doing a lot of avoidance behaviors. So stuttering therapy could focus on one or both of these sets of features or characteristics. So another interesting phenomenon about stuttering is this phenomenon known as fluency-inducing conditions. And these are conditions under which stuttering can entirely disappear, like 100% fluency. It's temporary and it's very specific kinds of conditions, and conditions that you wouldn't use to speak all the time, but things like singing or speaking with a metronome or talking to a pet or a child, for example. And what could be very confusing about stuttering is that it is highly variable. That's the norm, even for young kids, for adults. There's just a lot of variability in the extent to which somebody might be stuttering from day to day, or even in different situations in the same day. Very variable. And also, as we mentioned, very concealable. So a person can really hide it. And so this can make stuttering very confusing to listeners that aren't familiar with it. In terms of the etiology, we know that stuttering has a multifactorial etiology, which means that there are a number of different factors that are interacting to eventually result in stuttering. We know that genes definitely play a significant role. In fact, there have been researchers that have actually created stuttering mice through genetic research, which is really amazingly fascinating. But in any case, the genes are certainly interacting with a number of other factors. So a child's temperament, for example, their language abilities, specific aspects of their environment are all going to interact to shape the extent or whether the child is going to start stuttering. And finally, and this will explain the image that I put up here, there's a very classic metaphor to describe stuttering. Specifically, the speech symptoms of stuttering are described as being the tip of the iceberg. And what that means is they may be the only features that you as a listener see, but there are layers and layers of very complicated emotions associated with stuttering, and these are often far more significant. So you see how deep those go relative to what you see at the surface. Okay, so I wanted to focus a bit more on what non-clinicians learning about stuttering can take away, what you as listeners can do to support people who stutter. And so the first piece comes from this video that I mentioned by John Hendrickson. In his video, he presents this idea of a made-up pretend device called a listenometer, and imagines that you can use this device to just take away or put back in the specific disfluencies associated with stuttering. And then after presenting that idea, he suggests, you as the listener can basically be the listenometer and fill in all of the pauses that you're hearing with patience. So I thought that was a nice takeaway. But some other general pieces of advice, and as listeners, I know everybody means well, so we want to help, but sometimes we don't quite know how to best do that. And so if you look at the image you have here, you see the girl is trying to say her name and is stuttering on the M. This is actually very common for people who stutter, to stutter on their name specifically. And it's also very common for listeners to try to fill in, especially if they know the person's name. But this is very frustrating and quite annoying for people who stutter. And most will say that they prefer for people never to interrupt or to guess what they're trying to say or to fill in their words. And the other thing that most people who stutter will say to never do is to offer advice like take a breath or slow down or take your time or things like that. Even worse would be what some call being a speech cop. And sometimes this comes up with kids in particular, and especially if they're involved in therapy and their friends might say, use your strategy or talk slowly, use your turtle speech or whatever they're learning in therapy. And this is really never appreciated. So, they know what they need to do and they'll work with their therapist to figure out when and how they want to do it. But even if it's well-intentioned, advice is usually not helpful. The best thing you can do as a listener is to simply ask and clarify how you can best help the speaker. Everybody's different and everybody has different preferences, and it's possible you'll meet somebody who will sometimes want you to fill in, especially in a certain situation. So just ask. And the final takeaway, and this is something that's really being talked about more and more in the stuttering community, but for others to recognize that it's really okay to stutter, and it isn't necessarily a problem that needs to be fixed. A better way to think about it is that this is a different way of speaking that maybe you as the listener can adjust to. I might underscore that particular point as one to really, really keep in mind. It touches upon a neurodiversity perspective that we're seeing across a number of different topics and areas. Okay, so for those who want to learn more about stuttering, there are tons and tons and tons of resources out there. I'm just sharing some of my personal favorites. So one of these is Paperboy. This is actually, it's a great read. It's a very easy read. It's also a great one for kids. So it's good for all ages. I enjoyed it as an adult, and I also shared it and discussed it with my son when he was about 9. So we loved it. It's another interesting fact about this point is that about this book is that the author is a native Memphian, and the book is set in Memphis. So it makes it extra interesting for anyone here. I Talk Like a River is a new one. It actually came out sometime during COVID, I think. And so there were a lot of like webinars and read alouds that were going on. I think it was about 2020. But it's just a beautiful tale about stuttering. And so again, if you just do a quick Google, you might be able to come across some read alouds by the author or interviews with the author. Out With It is a very thoughtful memoir written by Catherine Preston. I actually select a lot of excerpts from this book to read out loud with my students in the class that I teach about fluency disorders, because she talks so much about her personal experiences and also what she learned about stuttering on her journey. And let's see, the last one I wanted to mention is a podcast called Stutter Talk. They've been doing that podcast for a while, so there are probably like 600 or 700 or maybe even more episodes on it. And they have lots of interesting guests on there, many of whom are stuttering researchers or people who stutter or both. There's sort of a tradition in the field for many people who stutter to become speech pathologists and work with people who stutter, and also to become researchers in stuttering. So it's a great way to learn more about stuttering. Okay. Yeah, those are the ones that I wanted to highlight. So I'm about to kind of shift into this next area. Did somebody have a question?
I just posted in the chat that I benefit a lot from the Stuttering Foundation's Facebook page and Instagram page. Great resource. They tend to populate it with articles and, both journalistic and academic, and it's a good resource.
Absolutely. Yeah. Thank you for bringing that up. The Stuttering Foundation, the National Stuttering Association too. And they host some events that are wonderful. I should have included that. Say, Stuttering Association of the, I mean, I can share a bunch, so I don't know if there's something else I could put them. Maybe I could put them in the chat in a little bit so that y'all have this information. Marion, was it you? Did you have a question?
Yeah, I just was thinking if early intervention is more effective than waiting later in life, or can you intervene at any stage and have positive results?
Yeah, so that's a very good question. The answer is that absolutely you can see benefits and change at any point in life. Early intervention can be more effective in terms of the kinds of change that you see. So very often kids will recover completely from stuttering with early intervention. So the change there can be much more significant and pronounced. After about age 6, once stuttering persists beyond the age of 6, it's unlikely that it's going to disappear. But therapy will still be very effective. But very often the focus of therapy should always be on more than just the observable stuttering behaviors. So, ultimately what we always want to focus on is communication. We want kids to be talking and to be effective communicators, no matter what their speech sounds like. So, it's the layers of emotion that make stuttering much more complicated and much more debilitating. And so therapy—
Hello, Orma, how you doing?
Has to focus on those aspects of stuttering. But as a child gets older, therapy will tend to focus a bit more on that than on just surface features and, trying to teach new ways of talking, for example. But, the therapy for young children, you might be surprised to realize this, but is very often very indirect, meaning we don't often teach kids new ways of talking directly. Sometimes that's necessary, but not usually as the first step. So usually we're working on the environment and trying to find ways to facilitate fluency all around the child, because we know that the environment plays a role and contributes to the way stuttering is going to develop and evolve over time. So we try to provide as much support as possible. And then the direct kinds of intervention really only happen if it's necessary. For example, if a child is showing a lot of signs of tension or struggle or frustration, then we step in and more directly teach different ways of talking or different techniques for increasing fluency. But, and we can teach that at any age. But I will say that very often, even if somebody has learned ways to talk completely fluently, they may choose never to use them because it feels unnatural and it feels uncomfortable. It just doesn't feel like them. So yes, there are techniques that you can learn, and many will choose not to use them or to use them when they want. So maybe if they're in an interview, they'll pull them out and use them so that they can be maybe more efficient or avoid some of those hard blocks. But in other situations, no. And, there are a lot of different ways to think about the intervention too. Like, yes, you can talk about different ways of talking that promote fluency, but you can also talk about different ways to stutter that are easier. So there might still be some interruptions, but they're very fleeting and they're not strained and they're not full of struggle. So ultimately, many, many, many people choose that type of approach, like focusing on the attitudes and the way they feel about stuttering, but also keeping their stuttering from really interfering much with their communication by keeping those blocks pretty light, pretty easy, and not full of strain and struggle. Does that make sense? Okay. Any other questions? All right.
In the chat, there's some more, Naomi, I think.
Oh, interesting. I'm not
Charles
seeing
had one.
Okay. Why am I not seeing the chat? Oh.
You want me to read it?
Ah, I got it now. Is the incidence consistent worldwide? Does brain imaging provide any insight? Okay. Yeah, good question. So the incidence is pretty consistent worldwide, although there are some differences across different cultural groups. I'm laughing because I'm thinking of a particular slide that I share in my class that basically provides some evidence and then another paper that provides the opposite evidence. So I don't even feel comfortable enough or confident enough in these findings to share anything specific. There might be some fluctuation, like some differences in prevalence with different cultures. The one that I think is the most consistent is the finding that certain bilingual speakers, not bilingual, so I'm not saying, and I want to be very careful here, it's not that bilingualism causes or increases the likelihood of stuttering, but you do hear more disfluencies in bilingual speakers. So they're not identified as people who stutter, they're not concerned about their speech in any way, but the cutoff that we usually use for identifying stuttering in monolingual speakers is exceeded in fluent bilingual speakers, which is kind of interesting. So I know that's not exactly your question, but that's maybe one of the more consistent findings. But otherwise, like different countries, the findings are pretty similar. Now, in terms of brain imaging, yeah, there are, I don't do brain imaging and I don't do neurophysiological studies, but they do provide some insight. And the insights, the patterns that we see are, first of all, related to activation patterns. Usually the left hemisphere is activated to a higher level in speech and language tasks relative to the right. Speakers who stutter seem to show an opposite pattern. So they have somewhat less left hemispheric activation patterns and more in the right than you would expect. So there's like a reverse type of asymmetry there. And interestingly, there also seems to be some associations with compensatory strategies, like some suggest that maybe the right hemispheric activation is associated with compensating for stuttering. And also, and this is the interesting piece, we see increases in left hemisphere activation as a result of therapy. So when people are focusing on different ways to facilitate fluency, it does seem to induce some measurable changes. that you can detect on brain imaging, particularly using things like functional MRI, where you can see the changes in a task, over the course of a task. Did I answer your question, Charles? Okay, now I see the point about, oh, 1 minute, Stephen had a question. I mentioned that attention influences interactions with stuttering. Are people with ADHD more likely to stutter? So that's an interesting one. There is another fluency disorder that's not stuttering, but is very often confused with stuttering or can overlap with stuttering, and that's called cluttering. Cluttering is somewhat different than stuttering in that the types of disfluencies tend to be what we call typical kinds of disfluencies. So whereas stuttering is characterized by, we call it either stutter-like disfluencies or more atypical kinds of disfluencies, the repetitions, prolongations, and blocks. Typical disfluencies consist more of revisions, like saying something and then stopping and revising. Sometimes we refer to those as mazes, or a lot of interjections, things like that, or repetitions of phrases. So all of these are more typical kinds of disfluencies. They interrupt the flow of speech, but not in the way that you really associate with stuttering. And so cluttering has sometimes some of the stutter-like disfluencies, but more a higher proportion of the typical kinds of disfluencies, and also comes along with some other features that you don't see in stuttering, like weak language skills, some difficulties with organization and executive function. And so that's where the ADHD piece fits in a little bit more. So a lot of people who have more ADHD kinds of symptoms and maybe kind of talk very fast, they might be the kind of person that, like, you often have to ask to repeat themselves because you didn't quite catch it, words are being swallowed. That's more typical of cluttering. And again, that is much more associated with ADHD. But what's interesting also about cluttering and stuttering is that sometimes kids kind of flip-flop. So you might have somebody who's primarily a clutterer and then some, like for a period of time, starts to produce a lot of stutter-like disfluencies and needs a type of intervention that's a little bit more focused on that. And so, I remember working with somebody who was about age 9 when I started with him, and he was actually coming into therapy somewhat for fluency concerns, but he was also struggling a lot in school. So academically, he was really experiencing some challenges. And he had like a possible diagnosis of ADHD. It wasn't official, but he kind of just struggled with learning and language. And that was mostly what I focused with him on. We did a little bit of work on fluency, but mostly on language, strengthening his language skills so that he can be more successful in school. And then interestingly, as he approached his bar mitzvah, he started to show some real stutter-like kinds of behavior. So he was struggling a lot more with his disfluencies and producing way more blocks than the revisions and the interruptions that were more characteristic of him. And it seems like he was really very anxious about, giving a speech in front of family and friends. And there was just a lot of stress, there were high expectations, and he felt like he just, he couldn't really voice all of this, but it was interesting that it came up right around that time. And, we practiced his speech and we practiced working through blocks that might come up in his speech. And what was amazing is that he passed that period of time that seemed so tumultuous for him. And then he shifted right back into his cluttering-like patterns. And all of this kind of dissipated. So that's not so uncommon that you would see, kind of veering from one type of profile into another. Because it's rare to see like a pure clutterer. There tends to be some mixing. All right, any other questions? I think I got everything on the chat. Okay. All right, so I wanted to talk just a little bit about some of the research that I'm working on in my lab. Most of my studies sort of fall into 3 boxes. With the last one being much more recent and ongoing. So the first question that I've been thinking about, this was actually what I did my dissertation on and some of my earlier work after I moved here, and that is whether it's helpful to pay attention to your speech, or is this something, or is attending to your speech, the process of speech production, just counterproductive? Kind of let it run on its own and don't think about it. The second question has to do with whether there's an association with stuttering and problems in controlling attention. So we talked about stuttering being multifactorial and that there's a genetic predisposition, but that there are different factors that can contribute to it. And we know that cognitive factors is among those factors. So attention control was the factor that I was most interested in looking at, and a little bit more soon in terms of why this particular factor seemed relevant. And the third piece that I'm really focusing on now is how people who stutter might allocate their attention to stimuli, so to words or pictures that are being presented when these are emotionally salient, and particularly when they're relevant to stuttering or to personal stuttering experiences. So this first idea had to do with attention, right? Whether more attention is better, or maybe whether less can be more, or more can be less. In other words, what I mean by more can be less is sometimes it could be that paying more attention or allocating more mental effort to something is less, meaning it's counterproductive and is going to end up interfering with performance. So, we generally think of attention or cognitive control as being beneficial. These support goal-directed behavior. We use these kinds of cognitive processes to support learning, reading, thinking, problem solving. And we rely on this frontal region of our brain, the prefrontal cortex, to perform these kinds of tasks. And so, we kind of think of this as, of course, this is good. We want to use this in most things that we do, but the question is whether it's really always advantageous. And the reality is that we see that sometimes mental effort that's not needed, that's unnecessary, ends up disrupting the flow of activity that's already been automatized. So when you have sequences of movement that have already been kind of chunked together and they're being performed in these automatic sequences, paying attention to it breaks that down and ends up being counterproductive. So this phenomenon is sometimes referred to as de-chunking. It's also been referred to as choking, specifically when this is occurring in like a high stakes performance kind of situation. And that's when we tend to put more mental effort into something because we want to do so well, and it ends up being counterproductive. So it turns out that hypofrontality, meaning using less of that frontal region, is sometimes beneficial. And so this is an idea many of us can intuitively relate to, because if you think about, playing an instrument or even typing on your keyboard, when you start thinking about that process, it can fall apart. If you want to learn more about it, Sion Bilak wrote this great, very accessible book called Choke, where she talks about all of the different scenarios this comes into play. A lot of her examples are sports related, so those who are sports fans might enjoy reading that one. And I basically applied this idea to stuttering. So I had a baseline condition where I had people responding to prompts, and you can see some examples of that on the screen here, like, what do you do to relax? Describe the first car you ever drove. I had about 80 of these. And so under the baseline condition, people just gave 60 seconds of talking in response to these prompts, and I was recording that speech, and then I analyzed it later to look at the disfluencies. I also had what we call dual task conditions. This is when I had the participants speaking, so doing that same speaking task, but also performing a completely unrelated task that was distracting. So in a very simple task, the sustained attention one, the participants were just hitting buttons on the right or left, depending on where that circle was appearing. And in the more complex working memory dual tasks, the participants were either adding numbers mentally while they were talking, which is kind of hard, or mentally shifting this circle in a grid based on the arrows that were appearing on the screen. And so the question was, would there be a reduction in speech disfluencies under distracting conditions? And if that happened, we could say that actually less attention is better, and it promotes this more automatized production of the movements that we need in speech. And that's exactly what I found. So this is kind of a simple version of the results, but it's showing you the percent of disfluent syllables, and you can see that there is a higher percentage under the baseline condition, but lower under both of the dual task conditions. And interestingly, we checked whether this was related to speech rate in any way, and it was, but in a good direction, meaning that speech rate actually increased under the dual task condition, and disfluencies were decreased. So people were more fluent and speaking faster. So it does seem like it was increasing automaticity when attention was divided. So I'm moving on to this next area of research, looking at attention control. And how is attention control related to stuttering altogether? And this goes back to theories that are looking at these different factors that might contribute to stuttering. And some suggest that maybe stuttering is related to children's basic, like an inability to move on after they've experienced disfluency. They're kind of getting stuck in that physical and emotional experience. They're not very resilient, and they're having trouble regulating their emotions and just kind of moving on, shifting their attention. So I was focusing on this shifting attention from the experience type of idea and seeing whether we can find any evidence of that in a more basic experimental task. And so I borrowed some tasks from the cognitive development literature. This particular one is called the dimensional change card sort task. If anybody's familiar with the card game sets, it's very similar to that idea. So if you look at this test picture, you might notice that it has different dimensions, right? It has a color and it's a shape. And so which one you need to focus on is what this task is all about. You start off focusing on one dimension, and then the rule switches and you're asked to sort based on a different dimension. So I have a few slides now to basically put you in the experience of being a participant, a child participant in this study. And this is what it looked like. So the children are instructed, we're going to play the color game. In the color game, we look at the picture at the top of the screen, and then we find the matching colors on the big buttons. So this color is the same as this color. And now try to do the next few. Okay, so that probably felt pretty easy for you. Now we're going to switch and play a new game. And again, this task is for preschoolers, so ages 3 to 6. This game is called the shape game. In the shape game, we look at the picture at the top of the screen, we find the matching shape on the big buttons. Here we go. This shape is the same as this shape. Try it again, and again, and again. So that probably slowed you down just a little bit because it's hard to switch to that other dimension after we switch the rule. In the next part, I'm going to show you a task that we used for school-age kids. This was a little bit harder because we used what's called a mixed block. And what that means is we switch continuously from one dimension to the other. So here's what that looks like. You see the dimension that you need to focus on, and you need to find the matching one. See, it's unpredictable. And so that switching requires even more flexibility. And so what you can see on the graphs here is that the blue children represented by the blue line, the children who stutter represented by the blue lines showed a little bit more slowing in response to those conditions that require more flexibility relative to the kids who don't stutter. So what you see here is the post-switch part of the task relative to the pre-switch. Everybody slows down, but the kids who stutter slow down more. And the same with this mixed block compared to pure blocks that were the same rule applied over and over. So the last part of my research, and I'm wrapping up, I promise, I see I'm running out of time. This last part focuses on an idea called attention bias. And what that refers to is the tendency for attention to be captured by certain stimuli. These might be stimuli that are emotionally salient or personally relevant in some way. And so we're looking at whether speakers who stutter might allocate attention or have their attention grabbed more than people who don't stutter to certain types of stimuli. And we're currently doing 2 types of studies. One is an online behavioral study. By behavioral, I mean we're looking at accuracy reaction time on a computer-based task, and the other is an eye tracking study that we're doing in person. And as I mentioned, the eye tracking data is very helpful because we can look at dynamic changes over time instead of just trying to deduce what's happening from like a final reaction time measure. And so I wanted to share information about how you can all support our research. The best way is by referring potential participants to our lab. This could be kids that stutter, it could be adults who stutter, and it could be fluent speakers who are interested in contributing to science and serving as controls. We'd love to have you. So for adults, I'm looking at anyone over age 18 for an in-person study that involves the eye tracking. And for the school-age kids, that was actually started at some point during COVID. So it's all online. And so we can test anybody in the world. And we're looking specifically at ages 10 to 16. We do give Amazon gift cards to anybody that participates. And if somebody's interested, we notify them about any future opportunities because we're always doing new studies in the lab. So I'd love if you can send me people. And I'm happy to take any other questions you may have about stuttering or about my research or anything else really about communication sciences. I'm happy to share. And I do also want to wish everybody here Shana Tova Mituka, happy, healthy, and wonderful New Year to all of you.
That was fascinating. You know, I went through the program at the university in the middle 80s, and you know, it's like you said, I was over 6, so it was never, I've never recovered full fluency, but I have adapted a lot of techniques to get around it. I also really liked what you said about attention and its role, because I work in communications. When I was a freelancer, I did a lot of TV spots and radio spots. I was an acting major when I started college, and I've been in rock and roll bands as the lead singer. And I've even taught a class on effective business presentations. And in those scenarios, stuttering is never a problem. It never even happens, and therefore I never even have to think about it. And I've always wondered, you know, why, when the stakes are the highest, is it the least problematic situation? And that actually gives me a lot of context to understand what's going on there.
Yeah, it's very, very interesting. I mean, it seems like a lot of the situations that you're describing are these fluency inducing conditions. Like acting, for example, is a clear one. I've met many people, actually. When I was in New York and doing my dissertation, it was interesting. I somehow connected with a lot of actors there, and they were participants in my research, and they said exactly the same thing. That they would stutter, and many of them would stutter pretty significantly in spontaneous speech, but when they acted, they did not. Same with singing. I remember working with somebody, this was actually when I was back at the American Institute for Stuttering doing my training there. She was in her 60s and had been a special education teacher for most of her professional life. And she would stutter on pretty much every word that she used throughout her treatment. I mean, she actually really connected with the techniques and applied them because they helped her so much. But she said when she's at school and working with those kids, she never stuttered.
Isn't that interesting?
It's fascinating. But the other fascinating piece it's just such a puzzle, is that nobody truly understands why those fluency inducing conditions work. So there are a lot of studies that will use fluency inducing conditions and compare, let's say, what we're seeing in speakers under fMRI using fluency inducing conditions and then spontaneous speech to try to figure out, like, what is the brain doing differently under these conditions? Why are these conditions so effective? I mean, they're not effective in terms of being useful for everyday speaking, but they have a very clear effect.
Yeah.
But I thought too, Naomi, it was very interesting that you said that to kind of normalize it, like there's a range of speech patterns. And I like that. I thought that was very, very thoughtful and very kind.
Yeah, well, this is a really important idea. And, you know, you see it in a lot of different populations. Like, you know, for sure, you see in autism, there's a big push for understanding neurodiversity and,
Yeah.
you know, and speech production too. We speak in different ways. And I think when there's less pressure and there is a normalization, the stuttering actually changes too, because a lot of the associated emotions are just not really relevant if listeners are open to different types of speech production patterns. And there isn't all that stigma attached to it. I do see there's another question in the chat. Is there an association with stuttering with early or late speech development? Yes, there is. And any sort of delays in speech production or language does tend to be associated with persistence. So that would be another important risk factor to keep in mind if you see a young child stuttering, and a good reason to start early intervention. There's actually some more recent research, like 2020, 2021, that's looking at more risk factors that predict persistence, and speech and language delays, particularly speech delays, are coming up as a pretty consistent one. So problems with speech sound production.
Were there any observed impacts of quarantine on rates of stuttering?
That's an interesting one, and I don't know if we know that yet. What I do know is that there was a lot of talk in the stuttering community about two particular difficulties that came up a lot. The first was if somebody is blocking behind a mask, you actually don't even know it. So sometimes people who stutter were struggling to just make people realize that they were trying to say something. Because you couldn't see that. And similar kind of situation on Zoom, because if you can't hear anything coming out, then unless you're actually paying attention to that speaker and noticing that they're trying to produce something and it's stuck, you don't realize. But then again, there's the chat feature. Is that an avoidance behavior? It's a little bit complicated. In terms of overall like changes in prevalence or things like that, I don't know. And you know, some of these interventions could certainly be adapted to telehealth. So that was an advantage there. But I know those two situations came up a lot. People were complaining that was a problem. Children who stutter suffer with anxiety and or depression. So yeah, this is an interesting one. The literature is very complicated with anxiety. Depression is, I mean, certainly there could be depression. It tends to be an effect of the stuttering, and mostly the studies related to anxiety suggest the same, that if we see greater levels of anxiety or depression, it's an effect of the stuttering, it's not a cause. And it's more specific to situations that involve speech. What's interesting to me is that the work that I'm doing on attention bias actually mirrors what has been done in the literature in anxiety. But I'm not suggesting that stuttering is related to anxiety or caused by anxiety. I'm suggesting that there might be similar mechanisms underlying both of these issues. So it's a longer discussion, but the short answer to your question is that yes, but as an effect, not a cause. And the only other thing I should say about that is that, you know, I know Marion knows this about me, but I'm very passionate about interprofessional education and working collaboratively with other professions. And I think this is an area where speech pathologists really do need to connect more with clinical psychologists to figure out when there are concerns about anxiety or depression that are really out of our scope of practice, and that might need some input from another professional.
Hey, doctor, real quickly, I'm just kind of curious. Number one, you may know my father-in-law, Walter Manning.
Oh my goodness.
Yeah, he's been retired for a number of years, but used to be.
Walt. Yeah, he was here when I came.
Oh, wonderful.
Yes, in the office right next door to me.
Oh, cool. I'll tell him you said hello. That's great.
Oh my goodness. Please do.
Oh, wonderful. But my question is there a moment where it becomes stuttering versus cluttering? Is it based on repetition, or is it based on time, or is it based on a significant amount of occurrences?
No, I would say it's not an occurrence-based thing as much as a profile or pattern type of thing. So you couldn't say at any particular moment whether somebody is cluttering or stuttering, but you could say overall their profile is more consistent with stuttering, and overall their profile is more consistent with stuttering.
Okay.
And like I said, somebody could bounce in between. So at certain points in a person's life, they might look a little bit more like a stutterer. They tend to be one type a bit more than the other and maybe jump around temporarily to the other type. But yeah, it's more of a profile and pattern and general type of thing.
Great, thank you.
Oh, you're welcome. Other questions? Children who stutter are more affected. Oh yes, this is a very good point. Thank you, Mindy, for bringing that up. Children who stutter are definitely more affected by bullying in school. And you know, one point I really didn't mention, although sort of mentioned by educating and advocating different ways of helping people who stutter. Children who stutter are definitely bullied, and the best way to handle that is by educating people. So if you want to Google a wonderful, oh no, I'm forgetting his name. It'll come to me. There's an awesome video online by a boy who stutters. He's about 10 years old. Nate is his name. And he gives a presentation to his class about stuttering, and he just educates them. And what's fascinating is his talk is maybe like I don't know, 7 minutes. And then there's like about a 20-minute discussion after that, where his friends are all asking questions about stuttering and he's answering it. And he's really just owning it. He's educating, he's advocating, he's telling them what he needs from them. And, you know, when a child is standing up like that, it's really less likely that he's going to be bullied because people understand.
Mm-hmm.
So I think, you know, whether we're parents or teachers or any, you know, interacting with children who stutter in any way, I think this is an important way that we can help them. Anything else?
All right. Well, thanks, Naomi. This has been wonderful. I will definitely be volunteering. I'll send you an email as soon as we're done. We're done.
Oh,
We'll figure out
awesome.
what
That would
looks
be
like.
so great. Yes,
Yeah,
and
I'm
anybody else,
excited to
I'd love to see
participate.
you in the lab, or send anybody else that you know to the lab. Thank you all for your attention. I really appreciate it, and the great questions. It was a fun discussion, and really appreciate your all being here, showing up.
Thanks, everybody. We'll do another one of these. I think the next is October 7th. Let me check that date. Yeah, October 7th, we'll hear from Professor Daniel Keel, a law professor at University of Memphis. So thanks very much for joining us today, and we'll see you next time.
Thank you very much, Matt. Bye, everybody.